Good day and welcome to Of Many Things. I'm Father Matt Malone, editor-in-chief of America Magazine. As the country continues to deal with protests, legislative action, and advocacy around the fallout from the death of George Floyd and the debate about systemic racism in this country, we also are continuing to confront a pandemic, really a global pandemic around the coronavirus, as well as the economic crisis that pandemic epidemic has created. Uh, a lot of questions have been raised on our platforms at America Magazine about what the role of Catholic healthcare is in that effort, and also about what opportunity this crisis might present for re-envisioning not just Catholic healthcare, but how we deliver healthcare in this country. And so I'm joined today by Sister Carol Keehan, who is a daughter of charity. She's the registered nurse and the former president of the Catholic Health Association. Sister, thank you very much for being with us.
Thank you. It's a pleasure.
So I wonder if we could just start out with your sense of where we are in this epidemic. We have some parts of the country that are reopening, some parts that are just beginning to see a surge of cases. What is your sense of where we are in the life, as it were, of this epidemic?
Well, that's a very good question. And I think it's clear right now that we don't have much clarity about where we are. We're in a lot of places that have been significant hotspots. We're gently reopening, and we hope that we're safely reopening, but we have no guarantees. In other spots that some of which really didn't take as many measures, we're beginning to see spikes. You look at places like Arizona, where it seemed like the great outdoors, we didn't really need to do as much. And now their hospitals have been put on notice that they need to be, all their emergency preparedness needs to be on go. And so it's really very difficult. And there's no question that it's had an enormous impact on people and the economy as well as healthcare itself. So I, I wish I had the answer to where we are. I think we have got to be just exceptionally vigilant and willing to do whatever it takes to protect our people.
Now, over the course of this epidemic, I'm sure that you have been in contact with colleagues, friends, physicians, medical professionals, first responders who have been confronting this crisis. What have you been learning through that conversation?
Well, I think the first thing, Father, that and it's interesting to me and heartwarming that we've all learned is how incredibly committed our healthcare staff are. And I've been really touched. On the other hand, I've listened to the stress and the struggle. Um, and we talk about not having ventilators, and we've all lived through the ventilator issue, where every bed in ICU is filled. Everybody that's in those beds needs to be, and a terrible auto accident comes in with two people that need ICU and need ventilators. And what do you do? Well, if you multiply that times 20, that's what people are facing right now. And they're also facing the stress and fatigue of constant work, not being able to get time off. They're facing the stress of, am I taking it home to my children? Is the baby that I'm carrying being impacted by my doing my duty? Uh, there are just so many things. And one of the things that people may not understand as well is for all of us in healthcare, and I remember it as a practicing nurse, you always have, as you go home, did I forget something? Did I not do something I should have done? And when you're caring with all really critical patients with a very stressed equipment, stressed resources, there are a whole lot more potentials to miss something, to not do something you should do. And so a lot of stress, but a lot of commitment to this is what we're about. And we're going to make it happen.
Right. I think one of the things that a lot of us have learned through the course of this epidemic is that every public health crisis has not just a physical component, but as you point out, an emotional one, a psychological one, a spiritual dimension. Uh,
Absolutely.
and how is it, how is it possible in the course of dealing with an epidemic, being on the front lines, triaging patients, to deal with all of those different dimensions simultaneously? Is it even possible?
Well, I think we don't deal with it as well as we would like, and that does say that we're going to need to give healthcare workers and the people that support them a break if we possibly can, as soon as we can. But I think that sometimes the fact that people work together, and I've seen this in healthcare. I was a staff nurse in the emergency room in the Martin Luther King riots in Washington. Um, I lived through a couple of other major crises, including the 9/11. I was the CEO of a hospital in Washington. And I can tell you, when the going gets tough, the tough get going. And it is always amazing, whether it's a snowstorm or a catastrophe, the way people pull together in healthcare. And they just, they're at their finest. And I can tell you, I've heard people say who are doing cardiopulmonary resuscitation afterwards to a chaplain, Father, just knowing you were standing there and you were praying for me kept me going. And
Yeah,
it's been much harder this time because we put so much emphasis on the spiritual and emotional care of patients. And when you know people are dying or in danger of dying, and you can't let their families near them, and you don't really have time to stay and hold their hand as much as you'd like, and you know their family is desperate to see them, and they're desperate to see their family, and they're dying. I mean, that puts enormous stress on people because we see ourselves as the group that helps to fix problems and helps to smooth those transitions when someone is dying.
sure. We have heard, I think, a lot of those amazing stories of
Yes.
individuals working together as a team to confront this crisis in real time. Now, I wonder if we could take a step back and reflect on what this crisis might also tell us about the bigger story of healthcare in this country. What does it reveal about the healthcare system in the United States, and perhaps what we should do to improve it?
Well, I feel very strongly that our healthcare financing, we have a great healthcare system. We have great care, great education, wonderful advances. What we don't have is a great healthcare financing system. And this just blew that right out into the public. If 60 um, million people lost employment at, in 6 weeks, if how do you ever get all those people on unemployment, on health insurance, and that's when you lose your health insurance. And so the whole issue of how we finance healthcare in the United States, from the perspective of keeping our hospitals strong, from the perspective of keeping people out of the danger of personal bankruptcy, giving them health security, spending the their healthcare dollar wisely. This exposed it in spades, and we have to address it. We
Yeah,
we can't go back to this same old, same old. Also, it exposed the fact that we have not given as much attention as we should to public health. The fact that we didn't have the stockpiles that we thought we had for personal protective equipment, and
such as masks and gowns and things like
Masks,
that.
gowns, shields, all those things. And we created an environment that governors, hospital administrators, and the federal government were bidding against each other. We created an economic environment that was open to corruption in tons of ways. And at the same time, you had people risking their lives and the lives of their family to be there to care for people. So there's no question we absolutely have to look at how we're financing healthcare in this country today. We can't go back to the way it was.
And I think a number of people have observed those same phenomena that you just described, and say, the market forces that have in some ways created a great healthcare system in this country also work against us, and that they work against us in such a way that we should re-envision the entire system, and not have our healthcare tied to employment, and move away from a market-based system. I mean, from your experience over the years, what is your view of that?
Well, I think when people say that right away, they say, "Oh, you're talking about Medicare for all or some other socialist government system." And I think we need to change the system. I think it wouldn't hurt to have employer contribution, and in fact, I think it's what's expected to your health insurance. But truthfully, it shouldn't depend on the employment. And we see in the other industrialized nations, all of whom have healthcare for all, non-employment dependent, spend half of what we spend in their GDP, and no matter who researches it, they have better outcomes, they have better patient satisfaction, better morbidity, better availability. And so I believe we want a system that's uniquely ours, and there's nothing wrong with that. And it could be a great value to the rest of the world if we design it, but we've got to design it. We cannot let market forces design it, and we cannot let um, inappropriate coercion of legislators control it. Um, and that's a big job. That is a very big job, and it's going to take everybody's commitment.
And who is it that has to design that? Is it that a work of the federal government? Is it a work of the private sector? Is it somehow a collaboration between government and the private sector? Does it happen at the federal level, the state level? Who are the people, as it were, that you need in the room to design that system that's going to better deliver healthcare in a more equitable way?
Well, I think we need all the people that you mentioned and more. We need unions. We need providers. We need legislators. We need insurance companies. Uh, we need the public, and so it is going to be important to look at getting to a different model, and that's not going to happen without somebody's ox being gored. But the truth of the matter is, it is important that we rethink the healthcare dollar in this country and who's where we're spending the most of that and how much of that is wasted with the increasingly complex dealing with the financial system. Just how much it costs to deal with buying insurance, deciding what's the best insurance, getting paid as a provider. All of those things could be infinitely simpler. And we've made them so complex, and we've let the market make them so complex. We've got to be sure that the money we spend on health is spent on health.
There's also, I think, just as the this epidemic has surfaced a lot of stories and statistics that demonstrate the inequality in the healthcare system. I was also thinking about the the tragic events involving George Floyd, all of the protests that followed, and how that single instance uh, of police brutality really has has caused the whole country to reflect on systemic inequality. And so I wonder, bringing those two things together, I don't want to let you go without asking about this too. What are the ways in which the imbalances and inequalities within the American healthcare system play out along lines of race and of I mean certainly class, although we talked a little bit about that, but along specifically along lines of race.
It's it continues to be a horrible blight on our entire country, and our nation is better than that. And um, we just have to stop having classes of people, and particularly classes of people in the healthcare market that are treated so differently. A, a, a patient with a disease should be a patient with a disease. He shouldn't be an uninsured patient or a Medicaid patient or a high option Blue Cross patient. He should be a patient. People should get the care they need, not the care they can afford. And the tragedy is the whole climate of racism and what it does to people's economic security, their ability to get ahead, their ability to get a college education. All of those kinds of things play into what kind of insurance they end up having, and unfortunately play into other serious health determinants like where they live, the, the basic health care they've had, whether they can, if they come to an emergency room and somebody diagnoses their problem and gives them two prescriptions, can they fill the prescriptions? And so we cannot attempt to fix our health financing system without a massive attempt to address that. And we're going to have to do that in overdrive because it's been so poorly. It's played out as healthcare has gotten even more and more expensive. That disparity has gotten worse. So we can't just try to tweak it a bit. We've got to go into overdrive.
I know that also within the Catholic Church, we have, I think, uh, we experience all of these things as a spiritual challenge too, and both the epidemic and the challenge of racism, and yet, throughout these months of the epidemic, a lot of us, most of us, have been unable to, avail ourselves of the liturgy and of the
Yes.
sacraments, and there's a certain spiritual poverty in that. So I wanted to ask you, sister, also as a religious, what are some of the spiritual resources that you have found helpful in both of these things?
I think it's a combination of if if you are stay at home, you have a little more time. How did you use that time? Did you read? Did you pray? Did you help somebody else? And I think all of those things. And I'm a great believer, quite frankly, that when you got the blahs or when you are not feeling at your most devoted, if you start to focus on how much other people need and how much they're hurting. So in our area, we have a lot of people that don't have enough food. I mean, right outside our doorway in of our parking lot, we have a stand that's got canned goods in it and says, if you need some, take some. If you can, leave some. And so people stop by and get food. And then we have families that we know of and families that people bring to our attention. And being on the phone with people are lonely, that are not living with anybody else. Those are the kinds of things. writing notes to people you can't go visit, who are too old to be using email. And so I think it's certainly using time well, that you would really ordinarily be running around in other places, um, and finding the message God has for each of us. Because while none of us was prayed for this pandemic, we have it, and we know that somewhere in this, God has a message for each of us, and God has the ability to bring good out of this. And so I think trying to be open to those potentials is important.
So really, it's taking steps that really call us out of ourselves.
Exactly.
Yeah, and never more important than in a period where we're in a physical isolation. Yeah, I can see that. Sister Carol Keehan is the former president of the Catholic Health Association. She's a daughter of charity and a registered nurse. Sister, thank you so much for being with us today.
Thank you, Father. It was a joy.
I also wanted to bring to your attention that Sister has a piece in AmericanMagazine.org, which is titled How the Pandemic Could Reshape the U.S. Healthcare System. It's called How the Pandemic Could Reshape the U.S. Healthcare System. And look at that. It's beautifully designed and presented on my iPad and could be on yours too. So I encourage you to check it out because Sister has been at work in the healthcare industry for almost her entire life and has a lot of wisdom to share with us. It's part of America Magazine's continuing coverage about healthcare in this country. We have really, from the founding of America in 1909, published and reported content about how healthcare is delivered in this country, who is affected when it is not delivered as it should be, the inequities in our system, what works well, what doesn't, what might be the different solutions. We've had different voices in our pages debating that. I encourage you to check out that content at AmericanMagazine.org because I think you will find there a rich body of resources to draw upon as you begin to think about these questions in your own life and what kind of action you might want to take to address them. Please also follow us on social media and like our YouTube page if you want to have updates about this and similar videos from America. And please join us next Friday for another edition of Many Things here at noon. I'm Father Matt Malone. Thank you very much for watching, and God bless you.